All right, so today we're going to show you how to put a face mask together for the metabolic testing. We're going to start with the base of the face mask, which is going to be the clear cylinder part right there. We're going to start by adding the spit valve, which will go to the bottom, which is going to be on the opposite side of where the black topper is. Gently screw each one of these pieces into, try not to press too hard into it as to not strip any of the adjoining pieces. Next, we're going to work on our breathing valves. There are two pieces to a breathing valve. We've got a hard plastic ring, and then we have a rubber cover that will go over the entire ring. When placing the rubber over the ring, make sure that you push it all the way down until the ring actually clasps into the grooves at the bottom, allowing the ring to open up and have a nice flush seal between the plastic and the rubber. Each one of these is going to go on one side, so we are going to place the ring, and the ring should open up with the arrows on the side. The arrows are located by the black topper, and whichever way the arrows are going is which way the rings need to open up. We have two pieces that will go on top of these rings. We have a clear piece and a white piece. One only fits on each side, so you've got a 50-50 chance of getting it right. Again, you're going to screw this on, being gentle not to strip anything. Once that's on secure, you can flip the device over, put the ring in. Again, the ring is going to be opening with the arrow. Once you have both of those pieces together, you want to make sure that the openings are the way that they need to do, so you can gently press on from each side to make sure that both valves should be facing the same way. This allows air to go in from the outside, through the body, and then out through the clear side into the tube that we will have attached to our participant. The last piece for that is going to be this smaller white piece, which is going to be what the mouthpiece attaches to. And this goes on to the only opening left. There you have the beginnings of our face mask. The next thing you need to do is put together the two pieces that are going to go on the actual Met cart. This is going to include the white plastic piece that will also have another spit valve attached to it. And this white piece is going to be attached to this purple filter, and we're going to be placing these two together so that the white piece attaches to the flat side of the purple filter. The tapered side or the bent side is going to be going into the actual pneumatic on the metabolic cart. The other pieces will come together as we put our device onto our participant. As you can see that there's a head piece, which will actually hold the mouthpiece in place during exercise, and a nose clip that will also be attached to allow all of the air to go in and through the participant and then out directed towards the Met cart. So once we have the mouthpiece together, it's time to calibrate the metabolic cart. The metabolic cart must be turned on at least 30 minutes before calibration. This can be done by turning on the computer in the front, as a normal computer powers on, and also turning on the back of the pneumatic, which is going to be located by a green button on the back of the gas analyzer. So making sure that we turn on the gas analyzer through the back, which is going to be indicated by this green power light in the front. You should hear a nice hum, which is indicating that it is all on. And you also want to make sure that at the end of the 30 minutes that the white piece on the pneumatic is warm. This will indicate that your cart has been sufficiently warmed up. So in order to start the calibration, we need to attach two pieces. We will attach the purple filter, again making sure that we attach the tapered side of the purple filter to our black adapter. Then we're going to attach that black adapter to the pneumatic. Now the pneumatic is very delicate, so you want to make sure that you're doing this gently. Once that is attached, we will attach the hose The hose is going to be attached to the front white piece. You want to make sure that the hose is completely secured so that it does not fall off during your exercise testing. All right, once the hose is secured, you then take the other end and place it through the blue ribbon. This will assist with comfort for your participant during the exercise test. Now you're ready to calibrate the metabolic cart. All right, so now we're going to start with the gas calibration. You will select gas calibration from the left side of the screen, and you will be prompted if there are any updates or calibrations that need to be done. You can hit OK. Just please notify your TA or your professor of any updates that need to be done at the time. Next, you're going to be prompted to enter the temperature, the barometric pressure, and the relative humidity of your current conditions. Those are going to be located to the right of the computer. So first start with your current room temperature, making sure that you enter it in degrees Celsius and not Fahrenheit. Then the relative humidity in the room, and then your barometric pressure. Those are the only three things that need to be changed on this screen. Once those have been accurately updated, you can press OK. And you'll be prompted to turn on the gas calibrator to 90 degrees clockwise. So this is going to be the black lever on the actual gas tank, and you're going to turn this 90 degrees. Once that is open, you can then hit OK on the screen. And the metabolic cart will do the rest for you. At this time, it's important to make sure that you do not touch the metabolic cart or the gas tank, and let the process work through the calibration itself. During this time, it's measuring both air room, and then it'll be actually pulling from the tank to make sure that the air that is being pulled in is what it should be measured. When the gas is being analyzed from the tank, we should be looking at approximately 16% or 15.99% oxygen and 4% CO2. Once all the sampling has been done, you'll be prompted to turn the gas tank back off. This is to return the lever back to its original starting position. This is very important that you do so, or else the gas tank will actually leak and be empty by the next calibration. Hit OK once you've turned the gas tank off. And what you're looking for at the bottom of the screen are the bold numbers that is representative of the percent change. So with these two, both oxygen and CO2 percent change, you want values to be less than 1%. So on the screen, we have 0.4% and negative 0.5%, which are both appropriate. Once we have these values and we're confident in them, we can hit save. If for some reason these values are above 1%, you would hit cancel and redo the gas calibration as just demonstrated. If you do it a second time and the gas calibration is still above 1%, please inform your TA immediately. Once the gas calibration is complete, we're going to move into our flow meter calibration. This is right above the gas calibration on the left side of the screen. We're going to press this, and again, if you have any warnings or any kind of updates that need to be done, please notify your TA. But you can hit OK, and then you'll be prompted to enter the temperature, barometric pressure, and relative humidity again. If you've entered these for the gas calibration, they should carry right over, so you should not need to change them as long as these calibrations are done back to back. Once these numbers look correct, you can hit sample baseline in the upper right corner. And what we're going to need for this is we're going to need our 3-liter syringe. So our syringe is located right below the pneumatic on the metabolic cart. The syringe is very delicate, so please be sure not to drop this or to bang this, otherwise our calibrations will be inaccurate from here on out. So we're going to attach the front white piece, the small white piece of the face mask, to the black plastic piece on your syringe. And then you're going to attach your hose to the clear plastic end of the face mask. Once your face mask is complete, we're going to start the flow meter calibration. The first thing that we have to do is we have to do a detection stroke. So you're going to pull the lever in the syringe all the way out and return it back to its starting position. Once this is done, you'll notice that there's a yellow bar that is highlighted on the screen under detection. Now you're going to do 4 flush strokes. Once you have everything securely fastened, you're going to start with a detection stroke. So you're going to take the lever of the syringe and pull it all the way out and return it back to its starting position nice and gently. You'll notice that there is a yellow bar that appears up next to the detection. And the next you're going to do 4 flush strokes. So doing the same thing, pulling the lever all the way out and returning it 4 times. Each time a yellow bar is going to appear indicating that your stroke has been successful. Please make sure not to bang the lever back into the syringe. Again, this is a very delicate piece of equipment. Now we need to do 5 calibration strokes. We need to do these in a series that allows the different flow rates to be detected. So we're going to start with a flow rate, which is indicated by stroke peak right below the blue part of this moving screen, somewhere between 50 and 80 liters per minute. Now we're going to do one between 80 and 100 liters per minute. Now we're going to do one between 100 and 200 liters per minute. Now we're going to do one between 200 and 300 liters per minute. Now we're going to do one between 300 and 400 liters per minute. Now we'll do one above 400. One between 50 and 80. We'll do one below 50 liters per minute. Once your calibration has been successful, you'll be looking at the percent difference. You want this percent difference to be less than 2%, which we have successfully done here. Once we have a calibration that has been successfully under 2% difference, we're going to hit save. If that calibration was not successful, we would have hit cancel and done it again as demonstrated. If it have any trouble with this calibration, please see your TA. Next, we're going to move on to prepping for the ECG. So now we're going to be showing you and demonstrating how to prep a participant for an ECG. Today we're going to be showing you the modified versions for exercise and the electrode placements. And it's also important to know that although we're going to be telling you the definition criteria for where these electrodes are supposed to be placed, depending if you are working with a male or a female participant or just the general anatomy of your client or patient, you may have to alter these placements slightly. We're going to start with the right arm location, which is supposed to be right under the midclavicular line, 2 centimeters inferior to the clavicle. We want to make sure that we avoid application on the anterior deltoid muscle for both the right and the left arm. What you're seeing now is the skin being abrased with a tiny piece of fine sandpaper and then cleaned with an alcohol pad. It's important to make sure that we either shave individuals that might have excessive hair on their chest, as hair will interfere with the electrode placement. We also want to make sure that the skin is clean of any dirt and lotion and scraped to enhance the placement and attachment of the electrode. Next, we're going to do the left arm, which is going to be in the same place, again, the mid-clavicular line, 2 centimeters inferior to the clavicle. Next, we're going to move on to the right leg and the left leg. Both of these locations are going to follow the mid-clavicular line. They're going to be located 1/2 of the distance between the end of the 12th rib and the iliac crest. This will complete the locations for the limb leads. Now we'll move on to the chest leads. We're going to start with V1 and V2, which are going to be located in the 4th intercostal space, 2 centimeters right of the sternum. So you want to palpate for that 4th intercostal space. Scrape each of the areas and clean it with the alcohol pad. It's important to make sure that the alcohol dries before placing the electrode on any of these sites to make sure that the adhesion is best. Next, we're going to move on to V4. We're going to skip V3 and come right back to that. V4 is going to be in the 5th intercostal space, right following the mid-clavicular line. Going back to V3, we're going to place V3 midway between V2 and V4. Now our final 2 electrodes are going to be V5 and V6. These are going to follow V4, being placed in the 5th intercostal space. V5 is going to follow the anterior axillary line. And V6 is going to follow the mid-axillary line. Once all sites have been prepped, we can now place the electrodes. With the electrodes, you want to make sure that when you take off the clear back piece, that the electrode is nice and moist. If it is too dry, it's not going to stick properly. Starting with our limb leads again, we're going to attach the right arm in the previous spot that has been cleaned, making sure that the connection is complete on all edges of the electrode. Moving on, we're going to do the same exact thing with the left arm, making sure we avoid any placement over the bone as well. We're going to move now onto our right leg. And our left leg. And now we can move on to our chest leads, V1 through V6. V1 and V2 will be placed right next to each other. It's important to ensure that when you place these electrodes next to each other that we do not overlap them, and that any corners of the electrodes do not stick up from each other. Once V1 and V2 have been secured, we will go again to V4, following that mid-clavicular line. And then going back to place V3 between V2 and V4. It's important, in addition to making sure that the electrodes are sticking firmly to the skin, that there's no clothing attached to the electrodes as well. Our last two are going to be V5 and V6. Just as in V1 and V2, it's important that these electrodes aren't overlapping or raised in any corner. Now that we have our participant prepped, we can attach the actual electrode wires to her. Each one of the wires is going to be labeled for which site they should be attached to. So starting with the left leg. Simply attach each one of these prongs to the metal piece on the electrode. Doesn't matter what order you place these wires in or attach them in, as long as they are not tangled or twisted once the final application is done. It's important to make sure that there's a secure connection between each one of these so they do not dislodge during exercise, and to ensure that we get the cleanest reading possible. Proper electrode placement and securement is going to be critical for an accurate and readable ECG tracing. Once your participant is hooked up, we can now hook the pack up to the ECG cart and begin our resting ECG. Yep, so you want to make sure that you take the prongs on the electrode wire and securely fasten them to the metallic piece on the electrode. Simply pressing and clipping, releasing and securing, and making sure that that attachment is secure.
On our GE cart here, if you would like to program a new protocol or edit a previous one that is already programmed into the computer, the process is pretty simple. You want to click on this System Configuration button here, which will open a new screen. This screen here has a lot of options, but the only option you'll be looking for is under Custom Setup, would be Exercise Test. You click on this Exercise Test, which will open a new screen. Once again, there's a lot of options to click on, but what you're looking for is Protocol Editor at the top. You click on this tab, and what you can do here is you can look at the different protocols that are programmed into this computer already. If you would like to modify this program, you just click on the Modify button, and you can modify when the ECG report is printed out, when blood pressures are taken, speed of the treadmill, grade of the treadmill, all different things that are related to the protocol. Once you're finished, just click OK, OK, and OK to get back to the main screen, and your program or your protocol is now edited, or your new protocol, it will now be available when you begin a test. To start a new test with a subject, it's pretty simple. Just click your New Test button at the top screen here, and it's going to open up the patient database. If you don't have this subject already pre-programmed into the database, you need to click the New Patient button, which will allow the information at the bottom here to be entered. So you would enter in their names, an ID number, date of birth, height, weight, so on and so forth, and then click Accept once everything is filled in. In our case here, we already have this subject entered in, so all we need to do is just begin to type a name in, make sure that subject is selected, and click New Exercise Test. What the computer will do will open up a basically baseline reading of your ECG in the background. This box up top here will allow you to pick what protocol you will perform. So in this case, we're going to be doing a standard Bruce protocol. If you need to modify any type of medications, the test personnel, predicted max heart rate, anything of that nature, you can all do that here. However, we typically don't need to modify anything. It's already pre-programmed. Once that is set, your protocol is selected, click OK. And once again, this is going to give you basically your baseline ECG readings. On the left side here, you'll notice that the arrow changes to a hand, and you can change the leads that you are viewing, and you can cycle through those. Otherwise, it is a real-time ECG reading, heart rate being here, and again, each one of your views being interchangeable within this large screen. At the top right-hand corner here, you'll notice that you see all of our electrode placements. Okay, these will light up different colors based on how well the signal is that it is picking up. When they are highlighted green, that means they're picking up a good signal that you are ready to begin the test. If for some reason they're not green, reevaluate your electrode placement, possibly making adjustments or putting a new electrode down to get a good signal. Once you've checked all these things, it looks like you have a good ECG signal, your electrodes are lit up green here on the screen, you're ready to begin going through the pre-test measures. Simply all you need to do is use the buttons on the GE card itself to move through. You notice this first blue button here all the way to the left side says pre-test. When you hit this button, it's going to automatically take you to a new screen, which is going to create your testing protocol. So I'm going to hit the pre-test button here. It changes our screen, and if you notice on the screen, it's going to change to pre-test and in the supine position. This supine position is your first resting measure in which your subject should be laying flat on their back, nice and relaxed, while these measures are being taken. After about 30 seconds or so, you would want to take a blood pressure measurement. To insert that blood pressure measurement into the program, you hit this Enter BP button right here. When you hit this, it will bring up a blood pressure screen in which you can manually enter a blood pressure. So for an example, we're just going to plug in 115 over 70, assuming that was her blood pressure. You hit enter, and it's going to plug it into the screen here saying that was the blood pressure that you measured. After you feel like you have a sufficient amount of data or a good ECG reading, you want to print off this position or this pre-test position. The first one you're going to hit is actually going to hit the 12 lead button here. That's going to give you an ECG printout that's going to give you the real-time values or tracings that you see on the screen. When you hit this button, the writer will automatically begin printing. Once it's finally printed out, you are ready to move on to your next resting or pre-test position. So in this case, it's going to be a standing position. What you're going to do is you're going to have your subject raise from the supine position, and as soon as their feet touch the ground, you're going to hit the pre-test button again. What this is going to do is switch to the standing position, and basically what you're going to do is once again let that ECG signal kind of clear itself up, as you will get some artifact from the subject moving. Probably within the first 10 to 15 seconds you want to begin taking a blood pressure reading. Once you get that blood pressure reading, once again hit your Enter BP. Let's say, for example, we measured at 110 over 74. We enter that in. It now pops up on our screen. Once we feel like we have a good ECG signal and the blood pressure's entered, we'll once again hit the 12 lead button to print another sheet of the ECG out. Our final pre-test measure is going to be hyperventilation. So what you do with this is you want to explain to your subject that they ideally want to mimic exercise breathing. All right, it should be quick, deep breaths. You will demonstrate this for your subject, maybe have them go through 1 or 2 breaths to make sure they understand what you're asking for, and you will tell them that it's going to be for 30 seconds in length. You will tell the subject when to start this breathing and when to end this breathing. As you go through this, you will also need to hit the 12 lead button to print out your ECGs at appropriate times. You will do this at 15 seconds, and you will also do this at 30 seconds. You will also begin taking a blood pressure measure within the first few seconds of this hyperventilation to make sure that you get the blood pressure value before the subject ends their hyperventilation phase. So there's a lot going on with this measure, so just make sure you have everything coordinated before you begin. You also want to put a chair behind your individual, and if at any time they feel lightheaded or dizzy, that they can go back to breathing normal and sit down. So we'll demonstrate here what it looks like for an individual to go through a hyperventilation phase, remembering that we'll be taking blood pressure, and we'll also be doing the ECG printouts at appropriate times. Are you okay with going through it, the hyperventilation? All right, ready and begin. A little bit deeper there, yep. Good, there we go. So at the 15-second mark, we will do a printout. Nice job. You have 10 more seconds. Okay, 5 more seconds. And stop. Okay. Assumedly, too, we would have a blood pressure taken during that time, so we would enter that in before the last ECG printout as well. This concludes the resting or pre-test measures for your subject. At this time, you can get them up onto the treadmill and look to begin the exercise protocol.
All right, so now we're ready to go into the final stage of setting up our participant before the exercise test. We're taking the mouthpiece that we've put together and assembled so far, and we've now added a rubber mouthpiece to the small white plastic. We're going to hand the mouthpiece to our participant, and we're going to allow them to adjust it accordingly, making sure that the entire mouthpiece is in their mouth, fitting somewhat like a snorkel. And then we're going to assist the participant with the headpiece in order to secure it. So the headpiece is going to be placed just like a hat, ensuring to make sure that it is maximal comfort, trying to prevent any hair from getting tangled or twisted. The participant can help assist it to make sure that it's as comfortable as possible. And we use the back of the headpiece to tighten, to ensure that there's as little movement as possible, while also ensuring that the participant is comfortable. Once the headpiece is secure, we can then attach the mouthpiece using the 2 clear plastic arms on the side. And then twisting the white knobs at the top or base of the headpiece to prevent any movement during exercise. Once the headpiece and mouthpiece are secure, we can then assist the participant up to the treadmill. Before we attach the hose to the participant, we are going to enter and get the metabolic testing up and running. So we are going to hit VO2 metabolic testing, the very top selection at the left-hand corner. We are going to enter our participants' information, or we can look them up if they have been previously entered into the database. Entering new information is going to include the individual's last name, first name, age, height, and weight, ensuring that we have the proper units for each of those as well. We also want to select the type of test that we are doing under test degree. So today we're going to be doing a maximal exercise test. We also have the options to do submaximal. We're going to make sure that we have the treadmill selected. We also have bike, rowing, as options as well. And then we want to ensure that our heart rate and ECG is active. Once we've ensured that everything is entered correctly, we're going to hit OK. We're going to allow the computer to adjust to the settings, making sure that the zero flow and base gases are appropriate. We're also going to let the oxygen and CO2 stabilize for approximately 10 to 15 seconds before pressing OK to start our testing. Okay, we can hit all right, and we're going to attach our... We're now going to attach the participant to the hose. Making sure that the connection is tight, that there won't be any gas leaks throughout, and adjusting the arm on the metabolic cart to ensure comfort. If necessary, you can adjust the headpiece one last time just to ensure that everything is as comfortable as possible and as secure as possible before exercise starts. Once you've hit started test, you will have to wait approximately 20 seconds for the first measurement to come up. Erica, take a deep breath in. Big exhale. There you go. Once the timer starts, you'll be giving real-time oxygen and CO2 values as well as ventilation values. Every 20 seconds, this cart will refresh and provide values up onto the larger screen. Here we'll be looking at our time, we'll be looking at our oxygen consumption in liters per minute, our VE over VO2 ratio, our CO2, our RER. We'll be looking at ventilation, respiratory rate, tidal volume, and our VE over VCO2 values. Yep. After the hose is attached, we want to ensure that the nose clip is on, allowing all gases to flow from the outside through our participant and then directly into the metabolic cart for analysis.
Once your subject is ready and hooked up to the metabolic cart as well as the GE cart, you are ready to begin your testing protocol. Nice thing about the GE cart is once you've hit exercise, the cart pretty much operates the treadmill on its own. So that means it will adjust speed and grade without you having to touch any buttons. It will print the ECGs without you having to touch any buttons. The only thing you will be required to do is to put it into recovery or stop the treadmill in case of any type of emergency. So once your subject is ready, simply all you have to do is hit the exercise button located on the front panel right next to the pre-test button. Obviously you would warn your subject that they're going to begin the test, make sure that they are ready for the test. Once you hit this button though, it will go into stage 1 of the Bruce protocol in our example here, and it will continue progressing through the stages until we put our subject into recovery. So to begin, we're going to go into exercise here in 3, 2, 1. You will hit the start treadmill button. The treadmill will begin to go. You ask your subject to step on, and you will notice that the screen will automatically adjust to 1.7 miles per hour and 10% grade, which is the first stage of the Bruce protocol.
While continuously monitoring the ECG cart, your partner will select start exercise on the metabolic cart, ensure that the timing matches up with the time that exercise was started, hit OK. Throughout exercise within the metabolic cart, you're going to be monitoring the oxygen consumption, hopefully watching it rise throughout the different stages, reaching steady state right before the transitions happen. We'll also be monitoring their respiratory exchange ratio, and their heart rate will be monitored through the ECG cart. Also on the ECG cart, you will also be looking for any abnormalities within the ECG itself.
So obviously you can look at the various leads to evaluate this. You want to make sure that you have as clean a signal as possible while at the same time looking for abnormalities, and also checking on your subject to make sure that they are doing okay with the intensity of the exercise. If at any point you feel that the subject needs to stop exercising and go into recovery, you let them know and you hit the recovery button. Otherwise, you let them go until fatigue, and then at which point you will put them into recovery. At about the 2-minute mark, you will begin to take your manual blood pressure if need be. If you have an automated blood pressure cuff, they are typically programmed within the GE cart to automatically take the blood pressure at a given time. However, in the lab here, we do manual blood pressures, so you will begin that at about the 2 or 2:15 mark. As you can see, the screen will pop up asking you for a blood pressure at 2 minutes. Once you take that value, you can then punch in your blood pressure. For the example here, we will use 130/82. You hit enter, and it plugs in your blood pressure for that stage for your individual.
As we get ready to go into the second stage of the Bruce protocol, we're also going to obtain a RPE, or a rating of perceived exertion, from our individual within the last 15 seconds of the stage. To indicate this on the screen, we can also hit events. And once we obtain our RPE value, we can place it into the RPE slot. We can also add any other details to the test down in the free text area at the bottom of the screen.
All right, stage is going to change in 5 seconds. Make sure you notify your subject when they will move into the next stage. In this case here, we go to the second stage of the Bruce protocol, which is 2.5 and 12% grade. Notify them, get a thumbs up, make sure that they are aware that the speed and grade will increase, and make sure that they are prepared to do so before the treadmill actually begins to change. So in our example here, we're going to assume that our subject has indicated to us that they can no longer continue. When this happens, or if you see any concerns of when you need to end the test, you simply need to hit the recovery button. Do not hit the stop treadmill button. That will completely stop the treadmill bell. You want to hit the recovery button. That will lower the speed and grade of the treadmill back to a slower speed and a lower intensity for your subject. So we're going to go into recovery here. When this happens, your subject will begin their cool down. Your ECG screen here will switch over to recovery. It will print out necessary ECG printouts. You can enter blood pressures in. It will ask you for specific blood pressures, so on and so forth. But again, don't hit the stop treadmill button unless it's an emergency and the belt needs to be stopped.
With the metabolic cart, you will hit events as well. You will tag stop exercise, indicate the proper time, hit OK. Then we can move on to our end test. Hit OK, or yes. And once this is done, we can now remove the nose clip from the participant to ensure that we have better comfort, better breathing. We will also obtain our final measurements, whether it be blood pressure or rating of perceived exertion, to ensure that we have the closest measurement to the end of our maximal effort.
Once your subject has completed their recovery and their heart rate and blood pressure have returned to somewhat similar resting values, while they'll still be elevated, but they should be somewhat close, you can basically end the test. What you will start with doing is hitting stop treadmill, making sure to notify your subject that you are going to do so. So I'm going to hit the stop treadmill button here. This will stop the belt. However, if you notice, recovery will still continue to count up. We will still be monitoring ECGs. At this point, if necessary, have your subject sit in a chair, relax quietly, continuing to monitor heart rate and blood pressure. Once this has been fully completed, the recovery phase has been fully completed, resting heart rate or post-exercise heart rate and post-exercise blood pressure are back towards pre-exercise values. All you have to do to end the test is just hit test end, which is a blue button on the front screen. Once you do this, it will pop up asking you if you want to end the test. Just click on yes, and it will bring you to your post-test review. At this time, you will go through and interpret the test, which we will talk about briefly.
Once the treadmill has been stopped, you can remove the hose from the mouthpiece and then remove the headpiece from the participant. You can then allow them to continue either to cool down or sit down, whichever they may prefer.